we have this lineup of speakers in this webinar this afternoon to come give us an enlightenment and have an interactive section with what the policy is and what social protection itself is. So without much ado, I will be welcoming the Deputy Chief of Staff or the vocal person for NSIP Kaduna State in person of Ms. Saudi Amina Atoyebi for our presentation. Thank you very much, ma.
Thank you very much for having me. I don't know if you can hear me clearly. I also had a bit of technical problems trying to join in. Can you hear me?
Yes, ma, we can hear you loud and clear.
Okay, thank you. Thank you very much. And thanks for the invitation by Images to this event today. I'll try to share my screen and go as quickly as I can. Just to say that I once used to live in Oyo State some years ago when my mom worked there. We lived in Agodi at the time. So I'm happy to be amongst people from Oyo State. I'll just quickly go as fast as I can on the presentation. Like I said, I'm honored to be here to share our journey in Kaduna State in the area of social protection. Quickly go through the content that we have. We'll talk a bit about what social protection is, like Deborah had said, the impact of social protection in Nigeria, narrowed down to Kaduna State, talk about our social protection policy and its implementation, and the programs in the state. And we'll just go down right onto the challenges. So social protection, as many may be aware here, is one of those emerging sectors in the social space, and is one that is filled with a lot of terminology and a lot of jargon, that people, and buzzwords that people, development practitioners like to use. But I think to simplify it, and I always think that simple is better. It's I like the International Labour Organization's definition, which says that social protection is a set of policies and programs designed to reduce and prevent poverty and vulnerability throughout the life cycle. Usually in terms of social protection, the life cycle is, there's what is called the life cycle approach, which chronicles people from birth till death. And usually it's broken into 3 or different stages. So usually, what do you do to protect a pregnant mother or an infant who has just been born? And then for young children, and then you can go on to people who are at the working stage of their lives, young people, and then go on to the elderly. So usually, if you think of it in that mindset, you can compartmentalize and say, okay, I'll provide so policies and programs for people when they're children, when they're workers, or when they're retirees. Different people break it down depending on what suits them. Usually, social protection is broken down into 2 key components, and that's the contributory schemes, which are usually called social insurance, and the non-contributory schemes, which is often referred to as social assistance. As the name implies, contributory means you who is benefiting from that program, you contribute some part of your funds into it. It's not totally free. While for the social assistance programs, you don't have to contribute anything. Government shoulders that responsibility and ensures that they make the provision for you. Of course, we know that social protection is a human right, and Nigeria is signed on to the Charter on the Universal Declaration of Human Rights. And one of the things that advocates are pushing for is to ensure that it's a rights-based approach, because often what we see, like in not just in Nigeria, in developing countries, is that people see it as favor, as governments trying to, this is government help, is at my beck and call, is whenever I feel like I do it for the people. But it is indeed a right of the people, since we're a signatory to that declaration, that we must provide certain minimal benefits for people who live in our societies. So just like mentioned earlier, the different definitions of social protection, and there's a lot of debate. Even in Kaduna here and in Nigeria, when these conversations come up, is it worth it? Are you making the state a social welfare state? Are you further making people incapable of doing better for themselves by providing the support to them? But as we go along and as we see in developing countries, if you look at the rankings, the Human Development Index of different countries, you see that the countries which rank strongest are the countries that have good social protection systems in place. Because in the end, when we talk about vulnerability, it's one thing to talk about poverty, but vulnerability it can happen to anyone. It just takes one terrible incident or accident to happen to anyone. And then we'll find ourselves in situations where all our incomes, all our earnings, and everything is gone and you're at ground zero. Everything that you've worked for is eroded. And that's why social protection is important, because social protection ensures that even when those incidents occur, there's a net, there's a social safety net that protects you and keeps you from falling below the minimum threshold. There are many reasons why the advocates look or proponents support social protection, and the costs of not having social protection far out, they outnumber whatever reservations people have or whatever people look at in terms of the amount of funding that governments would spend on social protection. It's interesting as we have this conversation to look at other countries that have done this. We're not looking at the countries like the US, Canada, or the UK that have solid structure, or even the Scandinavian countries that have solid. Denmark is one of those countries that has a very robust system in place to support people from childhood till retirement. But let's look at developing countries in South America, countries that are similar to us that deal with huge numbers of poverty and derivation. And we've seen that social protection works, and intervention by government in this area has actually been successful. For instance, in Bolivia, which has the lowest GDP per capita in South America, it has one of the highest rates in old age pensions. And we've seen that they've been able to reach almost 100% of their population. So they've achieved almost universal coverage. And how much is this money that they're giving to the old people? $54 for people with contributory pensions and $47, for those who are part of a contributory scheme. And this has resulted in a 14% reduction in poverty at the household level. Because the way these things work is that when people earn money or they're being taken care of, they don't just spend on themselves. And look at it, when you take care of the elderly people, what are their needs at that point in their life? Their needs are significantly less than for someone who is working or who is younger. So that money goes into the household and it's able to handle, needs within the household. There's another example of Namibia, which is in Africa. They have a basic social grant, which is provided to all residents over 60 years with a monthly allowance of about $78. And the aim is to lift people above the poverty line and to also help them support their children and grandchildren to go to school. Of course, these systems come with their challenges. It's not been perfect, but they're doing it. And Namibia is right here in Africa with us. South Africa has done a lot in terms of social protection. They were the first to introduce a social pension and extend coverage to older people who did not have any form of social insurance. They provide $112 for each person aged between 60 to 75 years, and $114 for people above 75 years. And the studies that have been carried out now show that it has helped to significantly reduce inequality their Gini coefficient, which is what is used to measure inequality, has gone down from 0.77 to 0.60 since the implementation of the social pensions in South Africa. Brazil is another success story. The Brazil case is very interesting because when they started, it was more like a political thing, but it's now a case study that the World Bank and everybody is learning from to see what has happened because of the ripple effects that their social assistance programs have had across the country. It has not only provided money for consumption for them, but mortality rates have gone down. The Bolsa Familia, I think, is one of the largest social assistance, if not the largest in the world. Malnutrition levels have gone down. Their children are going to school. Inequality has reduced, all by virtue of this assistance, which is provided to families in Brazil. So now we'll come down to Nigeria. As we know, social protection has been there, even if it was not termed social protection. There are various programs that have come right from the military administrations to even when the civilians took over power. We've had several programs. This is just a short list of some of the ones that we could highlight, because if we want to go through every program that we've had since independence till date, it will be the subject of a webinar on its own. But we've had In Care of the Poor, which was targeted at extremely poor households. It had its own aims. It was targeted at female-headed households. And I think the coverage for In Care of the Poor reached about 22,000 households. Government has attempted to provide free access for pregnant women and children under 5. We have the community-based health insurance, which is a social insurance program where people can contribute. There's provision made for the vulnerable where funding is taken from the government to fund people who cannot even afford to contribute at all to the health insurance scheme. We've had the SHOPI, which was broken down into several component programs. But most interestingly is the National Social Investment Programs, which came into being sometime around 2016 and is still ongoing, which is a flagship of this administration. I'll talk in more details about the National Social Investment Programs. I have slides later to talk about it. What have we done in Kaduna State? So for Kaduna State, it was one of the campaign promises made by the governor, to try and provide a level playing field for every citizen of Kaduna, no matter what their background is and no matter what their economic situation is. It's been a journey, trying to get to where we are, and there's still a lot of work to be done. But one of the first things that the governor did was in 2019 to constitute a steering committee on social investments, pretty much on social protection, to say all key ministries, departments, and agencies come together and be part of this team and begin to think through and work on what we want to see in Kaduna State. So that was constituted in 2019 and is a combination of many of the key ministries. We have education, we have agri, we have health, we have the Planning and Budget Commission, finance, and many other relevant agencies. And it was this committee that did the work to develop a social protection policy for the state. Thankfully, we had partners who were willing to support. One of the most notable partners was Save the Children International. They provided us with the funding and technical support. And this team that was constituted by the governor were the ones that actually did the hard work in terms of gathering the information, putting together the data, and drafting the policy that Kaduna State now has. It was a very consultative process when we began. Unfortunately for us, we started at the time where COVID happened. That was early 2020. And then we had shutdowns and nothing was happening. but we were able to power through. And that's why it just brought to light the need to think ahead and plan for, you just never know what will happen. Thankfully, the state government had its e-governance strategy in place, and where we could no longer have physical meetings, we still continued with the work as a committee virtually. So in the course of developing the policy, we had several engagements where we had the governor himself present, members of the different arms of government. We engaged with labor, the relevant MDAs to provide us with background information on what was going on in the MDAs. We engaged strongly with CSOs. They were part of the process from start to finish, our development partners. We also made sure to ensure that people were not excluded. So we engaged with groups who are likely to be excluded from this kind of things. We ensured that we took out time to meet with persons with disabilities, our religious and traditional leaders, even the security agencies. We met with women groups, youth groups, children, and beneficiaries of previous and current interventions of government. Eventually, we were able to conclude that work, and which was reviewed at the Executive Council level, and it was approved, which makes Kaduna State one of the few states that has a social protection policy in the country. Now, what is this policy about?
Yes, so as I was saying, Kaduna State has a social protection policy. And what's the aim of the policy? To establish an inclusive, robust, realistic, and well-coordinated social protection system with a floor that leaves no one below the poverty line. The idea is to ensure that a level playing field is created for everyone, irrespective of their status, as I had mentioned earlier on. And one of the things the policy seeks to do is to improve the coordination and bring everyone together so that people are not working in silos, and to minimize duplication, or if possible, avoid duplication altogether in the social protection work that is being carried out across the state, because we got to realize that many MDAs were doing social protection activities and they did not know, and they were not speaking to each other, and the coordination was poor. So that's one of the things that the policy seeks to do. And there's several objectives of the policy. It provides for social assistance, like I mentioned earlier on, to provide the assistance where people do not contribute, to vulnerable groups in the state, to be able to provide social insurance where people can contribute either for health or for their pensions, so that when the day comes that they need to tap from this pool, they'll be able to do so. And we're also looking at labor market interventions, because we know that with the social assistance programs, they can't last forever. And in the end, we want people to be able to stand up on their feet. So what other ways can we coordinate better to ensure that people who actually have the ability to do something are able to do so without depending on total support from government? On the other side, we're looking at social care, to provide complementary initiatives to support these programs. And more importantly is the legislations, the regulations, and the institutional rudiments to strengthen social protection in Kaduna State. So like I mentioned earlier, for effective implementation, we also developed an implementation framework. So after the policy work was done, the teams went out to decide what will the focus in the first instance for the first 3 years of social protection be. And that we have done, and we're working on, implementing what has been decided in that framework. Just to say that our framework is quite ambitious, but what we're trying to do is scale down and try to look stage by stage, what can we actually do given the budget constraints and other constraints that we might have at the moment. Some of the priorities highlighted in the implementation plan include placing an enduring institutional arrangement for effective implementation. And by that, we mean we want to have a social protection agency in Kaduna State. And right now, the work is a bit ad hoc because the steering committee meets and coordinates these activities. But we want to institutionalize it, especially as this administration comes to an end, such that a new administration would not come and overturn a lot of the progress that has been made. We want to enact a law, meaning that it's legislated and it's binding on whoever is responsible or is in charge of the state. We also want to use technology to have a management information system. Like I mentioned, one of the challenges we've had is that a lot of the interventions were ongoing. We didn't even realize what was going on across the MDAs and how are they interfacing with one another, how are they coordinating, how are they speaking to each other. And then, of course, we know that funding is a major challenge. So one of the provisions, one of the things that has been clauses in the law is to have a social protection trust fund, something that we can pull from when we need. As we are all aware, when COVID happened, I think the whole nation started scrambling, looking for how to alleviate the effect of lockdowns that had happened, how to just mitigate the situation, because there's no set funds set aside for those kind of incidents or those kind of shocks that could happen. So one of the things we're looking at to do in Kaduna State is to establish the fund. All this will come as part of the social protection law. Also in the social protection policy, we're trying to strengthen existing social protection interventions. And that we have been doing, which is why I said I'll talk about the NSIPs as we go later, because that's a fundamental part of the social protection story that we're telling in Kaduna State. So right now, where are we? We have the policy in place. We have the implementation framework. We're working on the draft bill, which will be an executive bill. That's committee or that's law review committee is headed by the governor himself, with active participation of relevant MDAs, and he's driving this directly from the top here. In Kaduna State, just to touch a bit more outside the social protection policy, like I mentioned when I was talking about the institutional rudiments, it's not sufficient to give people handouts or give them conditionalities when you don't even have the infrastructure available. So for instance, if you say, I would only give you 5,000 naira if you go to school, if they don't have schools around them, then your conditionality is already flawed from the onset. So in addition to the social protection and the national social investment programs being run in the state, the government introduced free and compulsory education for the first 12 years. In fact, now it's right up until the end of secondary school. So education is totally free in Kaduna. That's to ensure that, okay, this is not a barrier, because one of the major things that happens that does not allow for a level playing field is when there's a price to education and people cannot afford to go to school. So the children of the rich will go to school and then the poor people get excluded. Our state contributory health scheme is very strong and is working. I think the coverage for the formal sector is almost complete. Where most of the work is ongoing now is in the informal sector to ensure that more of the people in the informal sector are covered in terms of health. We also have a strong contributory pension scheme. The Kaduna State government has enacted its laws on both pensions and the contributory health scheme. And the pensions have been raised to a minimum of 30,000 for all retirees in Kaduna State. We have the Women Empowerment Fund, which is targeted at female entrepreneurs in the state. We also have the Kaduna State Needs-Based Scholarship for people who come from families where they cannot afford to go to tertiary institutions. There's a state scholarship available to them. We have interventions in the area of nutrition. And very interesting and very important is that 1% of the Kaduna State government's budget has been allocated to social protection. This was a deliberation that was had at the State Executive Council, and it was approved that 1% of the budget will be allocated to deal with social protection issues. So now I'll talk about the coordination of the national social investment programs. Compared to previous programs run by different administrations, I think this is the first time that effort has been made to institutionalize social protection in Nigeria, and by extension within the states of Nigeria. What is even most remarkable about the national social investment programs is the collection of data. I can't speak to the federal data, but I know that in Kaduna State, we have over 2 million individuals on the social register, which is a scientifically proven database of poor and vulnerable individuals within communities. So in Kaduna State, we have about 2 million individuals with over 600,000 households captured. So what the governor did was quickly move, given that he had this vision for social protection, and he said, he gave an executive order to create the Social Investment Office. So before then, for the National Social Investment Programs, which has Empower, JEEP, the National Homegrown School Feeding Program, and the Conditional Cash Transfer Program, we had them domiciled in different MDAs across the state. But what he did was establish the Social Investment Office and bring everything under one roof, since the end goal was the social protection, framework or plans for the state. So everything has been brought in January 2020, that was established. And we've seen tremendous improvements in the delivery of social protection in Kaduna State just by the establishment of that office. Beyond that, we've seen increased engagement from people. People now have a one-stop shop to come to. Rather than go to the Ministry of Education, go to the Ministry of Rural Development, now they have one place where they can come if they want to support or if they want to work with the state in terms of social protection. And I think that these programs are very important because a lot of funding has gone in, not just from the federal government, but from the World Bank. And a lot of training has gone into the staff that we have on those programs. And what Kaduna State government is trying to do is to leverage on those people rather than create parallel structures. For instance, for any cash transfer program that we want to run in the state, we'll run it through the state's cash transfer units because they have the experience and they have the training and they have the manpower and the spread across the state to deliver on cash transfers. So we're using those structures which have been established by the federal government and we're just running with it. In 2019, our numbers were very low for the social register. We had only 32,000 households. And knowing that it's the federal government that provides funding to make this thing happen, the state government just decided, because this is important to us and we want to have data to use and to reach out to the poor people and vulnerable people within communities, the state government provided funding. And that was how we're able to scale up from 32,000 to the 600,000 households that we now have in Kaduna State. So that the data has been one of the most important components for us. And with that, even when COVID happened and the COVID intervention came, the private sector coalition came in with intervention for poor and vulnerable people in Kaduna State, was very easy because we just pulled data from the social register. Another thing that the Executive Council has approved is that every poor intervention targeted at poor and vulnerable individuals will be taken from the state social register, and that we have been doing effectively. So just to say why I said I'll come back to the National Social Investment Programs is because it provides a foundation, and this is not unique to Kaduna State. For any state that is serious about taking their social protection work further, it provides not just the human resources, it provides the technical expertise. There's a pool of people out there within your states that can be pivotal to whatever programs that you want to run, in terms of if the intention is to bring everything together and have a bird's eye view over the social protection programs that are being run in your state. This is just a run through of the different programs, which I know are existent in Oyo State as well. And these are our numbers. Just to say that because we have a social protection policy in Kaduna State, we've been able to provide linkages, we've been able to leverage on opportunities. And because Kaduna State has shown commitment that rather than the usual practice of asking people to provide names once there's an intervention, we have a database which is sacrosanct. And that is what we use for the interventions. We've had people reach out to the Social Investment Office now to say, even NGOs, to come and tell us, oh, we want to come and do an intervention in Kaduna State. Oh, can you give us names? Can you provide data of people in specific areas? And that has been very useful. And now we can now tell you that, okay, in Kaduna State, we have these numbers on the conditional cash transfer program. We have the numbers on the contributory health insurance scheme. We have those who are benefiting from the CBN interventions. And we can list and outline the different ways that people have been impacted in terms of social protection across the state. Initially, when the Kaduna State Women Empowerment Funds commenced, we're on our third cycle now, so we've had 2 previous cycles. It was left to communities and cooperatives to gather and provide names, but the Executive Council has now mandated that the people who would benefit from that fund will solely be taken from the social register. And that's what happens when you're able to coordinate better and, pull all your efforts to one place and, appropriately channel them. Just again, to highlight the benefits attributable to the Kaduna State Social Protection Policy. I said we've had improved synergy. Just before this meeting, we're having our State Steering Committee meeting. And every time we have those meetings and we have all the MDAs present, there's always room for better partnership and collaboration that we would have done if we were not sitting together as a group to discuss what issues and what programs are ongoing in the state. We've also been able to work better with CSOs. They don't take an antagonistic posture towards us. We call them to the room from the beginning to write and share our vision with them so that they're part of the process and they help us and support us where we as government cannot reach. We've been able to work better with our identity management agency to ensure that a lot of these people get enrolled on the national identity system, that they're able to have bank accounts as part of the financial inclusion strategy. And generally, we're working better with the different MDAs in the state. We've been able to increase awareness of social protection in the state, and that's because we've had more, we conduct more consultations than we used to do before, because a lot of times this activity is gone and people will be like, we're not aware, we don't know that anything like this is happening in the state. But because now we're actively engaging and consulting with different stakeholders, now not non-government players, people within communities, the traditional institutions, the religious organizations, now there's greater awareness about social protection and what is happening in the state. We've been better able to articulate government's intentions through the policy documents. Before the policy, we wanted to do these things. We knew what we wanted to do, but there was nothing to point to say this is the plan. This has been approved and everybody's on board with what we want to do. But having that social protection policy has made it easy. There's a document we can easily show donors, we can show partners. And indeed, we've had a flood of partners who have been willing and who have been working with us in Kaduna State. Like I said, it has also allowed for better coordination. One of the things we've also been able to do, and we still keep working on, is mapping the different programs that are happening across the state. And because of this policy, now it's the main reason why we're able to get 1% allocated from the budget, and even mandate that in Kaduna State, for whatever interventions we have, the social register is the first port of call to use to reach poor and vulnerable individuals. We've also done a fiscal space analysis, because again, when we talk about social protection, one of the major issues is the funding for social protection. Given COVID, given the dwindling resources across the country, we know that it's one thing to have a plan, but if you don't have money, you cannot even implement anything you plan to do. So what we're currently doing in Kaduna State is carrying out a fiscal space analysis, which has just been concluded, to see where we can better channel resources within what we have. Now we're not, apart from looking for new sources of revenue, where can we pull underperforming budget lines? How can we pull from those ends and channel to social protection because of the importance of social protection? We've established a lot of partnerships. We're proud and happy to say that we're working not just with the donor space. We have international development partners. We're working better with the federal government, and we're working with NGOs, CSOs. We're working better with the media and traditional institutions. Like I said, it doesn't go without challenges. It has not been perfect. It's been a roller coaster. It's been a learning experience, and we're moving along as we go ahead. We're taking one step at a time, trying our best to do what we can. We still have a shortage of manpower. For instance, the population of Kaduna State is almost 10 million. It's a huge state. The trip to a particular local government in Kaduna State is the same as going to Abuja or going to another neighboring state in Kano. So it's even geographically, it's widely dispersed. So we experience challenges with the human resources to actually implement and deliver on social protection. Funding is a major challenge. If 1% of our budget, this year's budget is over 200 billion. If you put 1%, that's about 2 billion. It sounds like big money on paper, but if you factor in, for instance, the cash transfer programs, for each cycle, if you're disbursing funds of, say, 5,000 naira per household, and you have 100,000 households, and you do that monthly, and you calculate for a program that is supposed to run for 36 years or 36 months or 3 years, it quickly adds up. You'd quickly see that 1 billion is perhaps insufficient to even cover 1 year. If you're talking about the school feeding program, on average, you will spend billions of naira in a year to deliver school feeding. So these programs cost a lot of money, and we're still dealing with the challenges of how to get funding to sustain or even expand the already existing programs that we have. In terms of communication, we're dealing with a group who usually are not they're an excluded group usually when we're dealing with this intervention. So communication and even reaching out, given the challenges of literacy and ability to communicate, is a major impediment which we're trying to work through. Kaduna State unfortunately has insecurity challenges in some parts of the state, which makes it difficult to even deliver on the programs that we're currently running. And even with our efforts, our best efforts at communicating and engaging with people, we still have insufficient awareness of what social protection is, especially from the angle of the people seeing it as a right to them. So that's where we are. I'll just to wrap up all the things I had mentioned earlier. Kaduna State is still work in progress. We've made a lot of progress, but there's still a lot to be done. We've improved in our coordination, and we're seeing the results of all that. Funding remains a major challenge for social protection. We can talk and have this conversation. If we don't have the resources to deliver, then it's almost impossible. It just remains something that is on paper. There's also the angle which was not captured in the slides about the politicization of social protection. Until we get to the point where people see it as a right and where everyone is eligible, irrespective of their affiliations, their religious or, their religious affiliations, their political affiliations, we will still have a long way to go in the delivery of social protection. And data is critical to social protection. The only way you can have a just and equitable system is if you have data that people will not question, or where people do not doubt what you are doing in the area of social protection. So I'll leave it at this, and thanks for listening.
Thank you, Ma. I believe that everyone had a great time listening to you. I particularly had a great time, and it's good. Like, I'm just looking like, okay, so this has been the journey. Aside all the things we see, and I hear my colleagues talk about on Social Protection Forum also, and I'd be like, oh, this is the journey, and we are so glad to be like part of it, at least listening to this journey and learning our own lesson. One thing that stood out was the data team for me, and that's where a lot of us are failing. And I believe that everyone here will be able to pick one lesson or the other to put to use wherever they find themselves. Institutionalization of social protection beyond coming and going. Let's have a standard framework in which it is standard, it is part of life, it is part of our system, and it's not like, okay, one person comes, he brings his own, another person comes, brings his own, and at the end of the day, we can put together what we exactly have. So we'll take questions now. Somebody is asking here, that Mr. Kwe is asking that, is there a way we can develop a central MIS database? Can you explain that for that, Mr. Kwe? Do you mean where everybody in Nigeria has it? Like it's a central one, every state is on that database? Is that what you're trying to say?
Maybe he can't hear. But I'll just take it from the point where I think I may understand what he's trying to say.
Okay, ma'am.
Yes. So, for instance, for the social register, there's the National Social Register. It's interesting that a lot of people do not have sufficient information on that database, and there are several reasons. I don't think it's a database that a lot of people are interested in using. If you're very political, you might not like the database because it's a database of people who are, poor, vulnerable, hard to reach communities, and nobody knows. You will not know them. You will not see. And that's why there's a lot of backlash when they say, oh, you're giving cash transfers. Who are these people? We don't know them. You cannot know them because sometimes even we that are delivering, we do not know them. The idea is not for you to know them because these are people that on normal circumstances, nobody remembers and they don't have any connection to government. So there's the central database. It's called the National Social Register. And every state has an offshoot of that. So states are able to manage within. So for instance, Kaduna State has its own social register, but which feeds into the national database. So the national will give you the numbers for everybody in Nigeria. And then within Kaduna State, we can tell you what the numbers are, where they are, and how they are located. Now, if we want to talk about building larger MIS systems, it's not easy. It's not something, even for the developed countries, they keep tweaking and retweaking because it's not an easy thing to do. As states, you have to decide what exactly and what are you trying to achieve by, building an MIS system. In Kaduna State is something we're looking at because, and the reason why we want to do that is to be able to house everything under one roof. We want to ensure that people are not double dipping. For instance, if we have a pool of 2 million poor people, how many of them are benefiting from cash transfer? How many of them are on the contributory health insurance? How many of them, so that not only avoid duplicates, we know how many we've been able to tackle, how many we've been able to provide succor for, and how many people who are still left behind and have not received any form of intervention. So in terms of developing, for us, it's still work in progress. We're working with our IT teams here. We have our chief information officer, and we've begun the conversation to see how do we tie this all over, and not even beyond even getting the data. How do we get to the point where these systems can automatically dispense, the benefits or the supports that needs to, without having to take cash around the place or having to work with third-party organizations to deliver. It's a more efficient way. It's difficult to build in the beginning, but hopefully we get there. I hope that answers the question since he didn't
I want to believe so too.
Yeah.
Thank you, ma'am. Then there's another hand, and that may be the last question we'll be taking. Sorry about that. We are trying to run with time. Okay, so Mr. Marachi, please, can you go ahead and ask your question?
Thank you very much. So my question is, when we talk about, it's actually towards the place of having the register compiled. And she spoke about trying to eliminate these instances where people get the kind of double transfers and all of that. And I'm also asking if the government of Kaduna State is also working towards ensuring that not just that people don't get double transfers, but also that that register is being updated. Of course, we know that every day people are also falling into poverty towards that hard to reach people that are in that poverty level where they need to actually get into that register. Some other times where people that are already in that register are no more. So if we keep transferring any kind of benefit to them, some other persons can be taking it, or some other times it may just be going to the wrong hands. And in the times where it will be automated, at that point, it will just be dormant in a particular account. So I'm thinking if the government is also working towards ensuring that all of those things are being put in place. Thank you very much.
Hello, ma'am. Let me just read out a question on the comment section so that you take it all together.
Okay.
Someone is asking that what is being done to tackle digital illiteracy amongst the poor and vulnerable. Then is also asking if there's anything being done to remove existing bottlenecks in social inclusion.
Okay. I can go on, right?
Yes, Grandma.
Thank you. Somebody is speaking. Okay, so I'll just quickly try to run through very, very, very valid question about the integrity, so to say, of the data. It's something that we've dealt with because there's one you don't know until you're in the field and you're dealing with these issues. But what we have done, and for next year, given that we've been able to generate a huge database, one of our focus for next year is to validate the data, because even with the different interventions that we've said, what happens is that whenever we need to use the data, whenever we mine from the register, we still have to go back on the field, bearing in mind that some of these people, and like I said, had to reach, some of them don't have phones. So until you go to their communities before you can find them, even though they are on the register. So we're trying to update the data. And that's why we're even working with our residence registration agency, which will provide them with national identity numbers. And we're trying to work with banks to provide them bank accounts, so that, because if people have bank accounts, you can easily run and see where they're double dipping or where they're cheating or where they're trying to game the system. So one of the things we're actively working on is updating the data. Indeed, people move, people die, the circumstances change, and we're trying to ensure that periodically we update that information. In terms of digital literacy, we're doing a lot of work with the Bill and Melinda Gates Foundation. They are interested in seeing, their work centers around financial inclusion, and Kaduna State is one of their partners. So we're even working with, in the first instance, we're working with our cooks, the school feeding cooks, because even though they have bank accounts, a lot of them don't know, they're not digitally literate. They don't know how to do anything. Even to go to the banks, they send their children to go to the banks, or their husbands do that on their behalf. And we've seen the gaps that have happened because of that breach in communication. So we're working with the Bill and Melinda Gates to strengthen them, to teach them how to do, and to have that confidence to be able to administer their own financial accounts or financial activities themselves. In terms of bottlenecks to remove social exclusion. Yeah, bottlenecks in social inclusion. We're working with the CSOs. That's why I said we have a strong partnership with the CSOs. They have spread within the grassroots. They have the knowledge and they have the ability to mingle with people. And we're working as a team. So they ensure, they draw our attention where the blatant cases of exclusion. They help us when we try to engage with communities to ensure that, people are not excluded. They are in every community. We're government. Most times we're at the center. We have people within the local governments, but sometimes they don't even have the skill sets to go out and engage people on this. So this is where we tap into the CSOs, and they have been providing enormous support for us to ensure that, social inclusion is put at the front burner. I saw another question about using NYSC. Indeed, we use NYSC, but again, it's not for long-term planning, it's not sustainable. But at the moment, we're using NYSC for our JEEP program for NPAR to help us with the enumeration, to help us with verification. The National Orientation Agency is also involved. But for more long-term, I think we need to have structures within the local governments that their sole responsibility is to deal with social protection with the state. But we're using COPPAs at the moment across the different LGAs. Thank you.
Yeah. Let me step in for Grace. She's having difficulty with a microphone, and at this point, I'm pleased to come back and to say thank you very much. There are a lot of comments in the chat button. You are so amazing. People like what you do, and we just want to encourage you to keep it up. At Images Initiative, we will come back to you on some of the work that we can do together to foster this relationship and expand on social protection in Kaduna State and at large in Nigeria. I just want to thank you. We know you have a very busy schedule. Do extend our greetings to His Excellency, of have a great day. And Grace will be bringing in the minute you are free to go. Bye-bye.
Thank you for the privilege. Thank you.
Come up now, Barrister Barrister Adebusoye, let's have you.
So that everyone, just going to take it a bit short and sweet because we had a very, very detailed, comprehensive presentation from Kaduna State, which shows the importance of the political leadership in social protection. Basically, I'm going to focus more with regards to some areas we need to be aware of, awareness, and of course, alliance building to actually make some advocacy points which we can take forward for social protection policy implementation. So we've been part of the Lagos State Social Protection Policy Technical Working Group since about 2014, also part of the National Social Protection Forum, and part of the National Social Protection Policy Review, CWG, and a few of us been part of that. And so as I was saying, I'm not going to go into, this was the outline, we're not going to go into a lot of the background. Basically, just to sensitize those who may not be fully integrated. I know some of our colleagues on the National Social Protection Forum are here, so maybe to build more synergy with regards to what we really need to make this social protection policy work. Of course, it's linked with the SDGs. See Goal 1, ending poverty, Goal 3, Goal 5, and Goal 8 as well, and Goal 10 actually directly connected with the social protection. And of course, targets 1.3 to implement nationally appropriate social protection systems and measures for all, including flaws. And by 2030, achieve substantial coverage of the poor and vulnerable. And 3.8, universal health coverage, including financial risk protection, access to quality social health care services. And 8.B, by 2020, develop and optimize a global strategy for youth employment and implement the ILO Global Jobs Pact. These are some of the targets. And this just shows actually the importance of focusing on social protection and the effect. You can see China, how it went up about 6, 7, 8 times just within a decade of concentrating the expansion of old age pension coverage. I won't go into this because this was covered nicely by the Kaduna State, but this shows the whole range of universal social protection across the whole life cycle, children, child support, up to old age, through working age and to old age. And of course, for social protection policy, generally the rationale is that we need a coordinated system of social protection programs. And we see in Kaduna State how, when you see the governor taking charge and ensuring that there is coordination. In Lagos State, where we've been working on developing our social protection policy since 2014, so it's in 2020 that we got it approved, and still we actually need to have that coordination system really worked out, and those are some areas why we need social policy. To prevent implementation of ad hoc programs is important because many times different people come and do different programs, but it's not sustainable. And then, of course, Nigeria, the context, many of us are aware of this, won't go very greatly into this. We're very culturally diverse, over 200 million. And of course, the poverty rate, we've got different quotations of 82.9 million individuals in 2019, 40% of the population living below the national poverty line. So this is huge situations that we have going on for us in Nigeria. The policy itself, the National Social Protection Policy, is an umbrella policy framework that incorporates related social agenda paradigms meant to reduce poverty and provide a life of dignity for Nigerians. It's designed to show the commitment of the states to effective mobilization and effective utilization of natural resources. And it's linked with, of course, the Constitution, the fundamental objectives, and the directive principles of state policy, a famous Chapter 2. The main goal of the policy is to establish a gender-sensitive and age-appropriate framework to ensure a minimal social floor for all Nigerian citizens for a life of dignity. And all the various states actually have similar linked goals. The objectives of the policy as well: to reduce poverty among people vulnerable to being poor, empower the poor and people vulnerable to economic shocks, enhance human capital development, to ensure a life of dignity, and of course, provide guiding principles for managing social protection projects and programs, and promote social cohesion, equity, and growth inclusiveness. and ensure citizens have access to basic social service and infrastructure. And this is very critical, especially now in a post-COVID era. And the main framework includes 4 levels of social protection provision. First is protective, that's protecting household incomes and consumption, which includes things like cash transfers, in-kind transfers. Secondly, is preventive, it is preventing households from falling into or further into poverty, including health insurance programs or contributory health schemes. And then thirdly, promotive, that means promoting households' ability to engage in productive activities and increase outcomes. For example, through public works employment schemes, you see that scheme of 774 local governments, which Ministry of Labour was leading. And then fourthly, transformative, that is addressing social inequalities and discrimination. Include, for example, core social protection programs, tackling gender inequality, promoting child rights, like that. So this is the transformative framework for social protection policy nationwide. And of course, it has to progressively realize, and that's something we need to always bear in mind. It's a long-term vision, like 20 years perspective, and we achieve medium and long-term objectives of the policy. It takes time and, of course, resources. And in the short and medium term, policies develops frameworks to allow the implementing MBAs to administer the interventions. Of course, in the long term, the policy is to establish minimum standards of coverage for all Nigerians. And very importantly, the individual states of the country will be able to implement and achieve these minimum standards of their own pace within 20 years. And we see that happening with what we heard from the Kaduna presentation. Targeting and, of course, and registration, that's a very important principle, is universality. There must be social protection for all Nigerians. And to achieve this, some individuals and groups need special attention. And of course, states have the flexibility to establish their own targeting schemes, mechanisms to find intended beneficiaries that should achieve special attention. So a combination of community-based targeting, assessment mechanisms, broad categorical eligibility, targeting by category and life cycle, all these things are all adopted. And we see that's one of the reasons why it's important for these databases to be harmonized. Of course, coordination and integration. The policies to be delivered in a timely, harmonized, and effective manner. It needs to be inclusive, the processes, to get inputs of all stakeholders. And of course, there must be partnerships developed with all stakeholders, including civil society, that represent best interests of intended beneficiaries. That's how some of us got involved, both at the state and national. So again, for coordination, partners need to commit to a common set of standards. The government of Nigeria needs to establish an institutional framework that will effectively and efficiently oversee the policy. Now, very quickly, the policy measures the current National Social Protection Policy. The first category, education and health services, and we see the various policy measures. For instance, the free school meals, which was alluded to in the Kaduna presentation, to all pupils in public primary schools. Those are the measures. Scholarships, learning materials. Also, all children and adults living with disabilities having access to free health care, education, and of course, require special services. Free health services for pregnant women, lactating mothers, children under 5 aged people, and people with disabilities. Universal access to health insurance scheme and other social insurance schemes. So these are things which we are seeing being rolled out in all the states right now at various levels. Another category is social welfare and child protection and social housing. We also have livelihood enhancement and employment. Another that you have unemployment insurance. You have public works programs for youth, very important. And then we have social insurance schemes, contributory pensions available to citizens over 60 years. Then further, we have other categories. We have social assistance, traditional family and support, and of course, legislation. Very important, a legal framework that specifically protects intended beneficiaries, including children, through inheritance rights, birth registration, childcare services, and breastfeeding. These are all things that are ongoing and important. And the review of the National Social Protection Policy has been going on for over a year now. We've been involved with that, and it's about the validation stage now. And some issues have come up, some emerging issues have come up. The issue of older persons. We've seen that even now there's even just recently, a few months ago, the president has inaugurated both the board and a director general with regards to senior citizens. The whole agency has been formed. So this has been part of the emerging issues that the National Social Protection Policy has been pushing. And in fact, a member of the review, TWG, is the director general. So that is one of the things emerging, and that is making progress on. Youths, of course, will make up the bulk of the population of the country, and this is very, very critical. We saw with the End SARS protests, special attention has to be given to the issue of youths coming up. COVID-19, of course, wow, the outbreak of the pandemic this year exposed the vulnerabilities of our healthcare system and the whole limitations of our national health insurance scheme. And we're just lucky that we didn't get the kind of hit impact as experienced in the Western world. So there's a very great need now, has been shown, that we really need to build a robust healthcare system. And it's also showed, pandemic also showed that we need to move beyond this transfer of 5,000 naira to households to build resilient social protection system. And we see that what is happening in the US, for instance, where they're talking of trillions of dollars for their citizens post-COVID. Issue of persons with disabilities is another emerging issue. They have not been really dealt with. That's why, because they've been lumped together generally. It's now that the issue of disaggregating them so that there's specific needs and challenges taken care of. During the COVID, we had experience then in Lagos State, where even though they had actually been saying part of the, in fact, Lagos State was the first to even roll out some palliative measures then immediately during the lockdown, early in March. And it was meant to be for elderly people, persons with disabilities especially. But persons with disabilities were actually excluded when it came to the practical giving out. And so some of our members, Dr. Adebayo, colleague, who was the president of JONAPID, Joint Association for Persons with Disabilities, had to go personally to the Ministry of Agri and follow them and push to ensure that the issues, that cohort, persons with disabilities, will be taken care of. Otherwise, they would actually just be skipped over while they're actually doing this mission. So very critical. It's an ongoing issue. Issue of children, girls, and women make up a vulnerable segment of the society. Whenever there are issues with terrorism, bandits, etc., they're the ones most affected. And so that has to be taken into consideration with this review, ongoing review of the National Social Protection Policy. The emergence of urban poor. With COVID-19, we've seen that the poor and vulnerable are not just in the rural areas, they're also in the urban areas. We saw what happened when at the point everybody started going out to loot, and that was happening in the urban areas, to loot all the warehouses where foodstuffs were being piled up. So urban poor is a huge issue, and it's an ongoing challenge. In Lagos State, we've seen the rise of various small crimes coming up because of poverty. There's a lot of poor people in Lagos State. We calculate about 60-70% on the poverty line. So it's huge. Issue of humanitarian crisis, another emerging issue, due to all the issues of the Boko Haram, bandits, kidnapping, herdsmen, farmer clashes. These are all bringing huge internally displaced persons, things that we didn't have previously. So these developments, National Social Protection Policy, National Safety Nets, Social Transfer Programs, of course, the new Ministry of Humanitarian Affairs, Disaster Management and Social Development. These are all fairly recent developments, which we should all be aware of. We're reviewing the current policy now because it's done, it's mentioned, it's done every 4 years. There needs to be a coordination with the new ministry, Federal Ministry of Humanitarian Affairs, the COVID-19 pandemic, and of course the need for standard monitoring and evaluation framework to track changes, and the need for a costed work plan. This is something that had not been in place before. And of course the process, we've gone through quite a few of this. We've formed the two WGs, we've consulted, we have gone on, validation of the diagnosis report, all these have been done. Agreement with the state, this was all done. And of course now we're on to where the validation of the draft policy at EXCO level, I think this is happening now. And of course we're looking forward to the next stage, which is development of legislation. And we have now some calls to action, finally, final call to action. This is something we want to get all parties on board. The federal government to accelerate action on development and passage of the Social Protection Bill to help strengthen poverty eradication. We need that. And so the National Assembly needs to be advocated to ensure that they actually pass it to protect this existing social investment programs. Anything can happen in the next administration may not be so friendly to some of the programs, so to institutionalize it should be passed into law. Also, that all data that should come from the National Bureau of Statistics, as the ministry saddled with the mandate for storage of data, so that we have standard data that can be verified and reviewed and updated in line with global best practices. Adequate investments should be made to capture more people in the social register. We need to urgently fix critical infrastructure, particularly electricity, roads, and railway, critical, otherwise we won't be able to get much done. Funding of health and education at all levels. We need to introduce sound, medium, and long-term monetary policies to boost the economy. A dedicated budget line for social protection programs in the 2023 budget. We see that in Kaduna State, they already have that with 1% of their budgets taking care of social protection programs. So this is something the national can bring on board. Issue of progressive taxation to ensure that we can actually get the funding to be able to provide for that economic well-being of all citizens. Our tax to GDP ratio is still very low. The FRS just mentioned there's so many millionaires, billionaires who are not paying tax in Nigeria. We need to intensify the war against corruption and block all avenues of financial leakages, because even the amount of assets that are just wasting, that have been seized or who are under EFCC and all, these are things that can even boost social protection programs if utilized properly. And all tiers of government, federal, state, local government, needs to take urgent steps to cut costs of governance by reducing the number of political appointees and overhead costs to free more resources for social protection programs. So many different special advisors, the advisor who's, so many, the cars, the convoys. These are things that need to be cut if we are really serious about social protection programs. And of course, call on the international community, needs to consider debt relief for Nigeria, a provision of grants in aid rather than more loans, because here we're getting more and more loans, we get more impoverished. And why? Especially in line with COVID-19. And of course, the issue of provision of COVID-19 vaccines for the poor in Nigeria is very, very critical. So I think on these notes, just very, very quickly, these are some areas which we see as critical for moving social protection policy implementation in Nigeria. Thank you very much.
Thank you, Barrister. Thank you for the presentation. We are very grateful. Thank you for honoring us and for coming to share your knowledge with us on this platform. We are very grateful, sir. There's something that I picked from your presentation is the fact that we need to go beyond just creating policies, as we have been okay, now we are beginning to create policies in Nigeria around social protection. What about the framework that help us to track the changes that the policy will be, so that we can work on probably reviewing or taking lessons from the monitoring and evaluation framework? And also the fact that we need to move beyond policy and start moving to creating bills on social protection, such that it just does not remain on the policy ground where we have to review for 4 years, but we work on having a bill that is standard. Thank you for sharing with us. So we'd like to take questions and comments now. Okay. Dr. Christie, please, you can share your question, ma.
Okay, good day, everybody. Thank you very much, Barrister, for the talk, but I think I missed some things. One of the key things I just wanted to find out is, what's the difference between the National Social Protection Policy and the National Social Safety Net? I didn't get what that was. What's the difference, really? Are they not the same thing? Are they not speaking to the same thing? And then I think the moderator has asked something along the lines, because my worry is we haven't even had the policies implemented, right? Because if there have been, are there any states that we're having this social protection policy, any of the strategies that we're talking about working, or are we at the stage where we're even trying to build the strategies? Thank you.
Yes, it's actually the social safety net is actually an aspect of social protection. The policy is the overriding policy that is meant to bring together all the various measures. If you saw part of the presentation, the safety net part is just one part with cash transfers, etc., which is just one part. There's also the aspect of health insurance. There's also the aspect of pensions. Many aspects. Employment, public works. They're all part of the overriding social protection. And the policy is actually meant to coordinate all these various aspects. So it's not. There are many things happening. And then with regards to the policies themselves at the state level, some states, like Lagos State, has developed and approved this policy. It's not yet law. Kaduna State has. A few states have. I understand Ekiti. Some states have got the policy. And a lot of the policies are very closely, they derive largely from the national, but there may be slight differences in all of them. But the important thing is that all the states, because the states actually, the entities that are actually going to implement most of the policies. The federal mainly is regulatory, and a few interventions which they do, all this empower, a few things which they do, but on a sustainable level, the states really have to take charge of the social protection policies to implement. And that's why it's very critical that the states come on board. It's very critical that they adopt policies. Different states are doing some things, but they're all ad hoc. That's what we're saying. There are a lot of ad hoc things that people do. A wife of a first lady may have a pet project to maybe help some people in some local governments or somewhere, and it stops when she leaves. This social protection policy is focused on trying to make sure that it's sustainable beyond the life of any administration, and that is coordinated as well. So I think it's very critical that we all get behind to push to ensure that the policies are established at the state level and ultimately made into law to give it just like you see what's happening in America. Why right now is a good example. We follow the presidential system that they're implementing Biden so many of these things. He could do some by executive order, but he has to push a lot for them to be legislated upon by the Congress so that there can be that power and sustainability. Thank you.
Thank you, sir.
Sorry. I'm sorry. I just need to be clear. Can I?
Please go ahead, ma'am.
Okay, so thank you very much, Barrister. But I'm just wondering. So the states, there's no clear mandate on the states to work on the social protection policy. There's no clear mandate. There's no who's in charge, who's supposed to do what. Because if we don't have those mechanisms clear, then for some states, nobody will do anything really. I'm just worried. Is there no clear mandate for any, in the states?
So each state, we have a three-tier system. So the federal cannot impose on the state, but it can encourage, persuade, and there are also incentives. For instance, most states now are keen into the either contributory health scheme or health insurance scheme now, because the Basic Healthcare Provision Fund, which is a very important key social protection program, is giving funds to each state through the NHIS, the National Health Insurance, to the state health insurance schemes. So each state is now trying to have a state health insurance scheme. So in ways like that, the federal can encourage the states to have social protection schemes. There are many World Bank programs, many things like that that encourage the states to. But if a state doesn't want to have a social protection policy, nobody can force it. And that's why it's so important to have progressive leadership. And that's why we see, for instance, in Kaduna, 2019, immediately they had set up things, and the governor ran with it and is taking charge. So there's a lot of difference at once the political leadership takes charge of something than when it doesn't. And that's why the states are actually very powerful, because they are the federating units. So there's no law that you must have the social protection, but no. But it's something which they know they should. There's encouragement from the center, all the different programs, Empower, etc. These are all things which are going through the states, and so that encourages all the states. For instance, have a SOCO, a coordinating office for all these safety nets, which originally are from federal, but they all have it now. So the states are following through because they see it's better for their own interest, self-interest as well. So in that way, they are actually at different levels of implementation.
Okay, thank you.
You are clear now, Mom?
I am clear but not satisfied. Thank you.
But one thing I can pick is that states cannot be forced. Just that many of them try to key into federal government programs. I know for the National Cash Transfer program right now, it's going on in many states, and Oyo State is even part of them. Like there are a few local governments in Oyo State that are part of that program. But as far as I know, in the states, we don't have a social protection policy yet. And I don't know if there's anybody or anyone already trying to do something about it.
So that's my worry, clearly.
Yeah, so
really no mechanism in place, so nobody's responsible. So you're going to find that some people will really run with it, but some people will do absolutely nothing because nobody knows what's happening, and I think that's my worry. Yeah.
Okay. Okay. So people, there are CSOs on the platform in each of our states. We can start working, maybe whatever pressure groups, and start putting things in place, and like asking questions from our states to put things in place for social protection. So thank you everyone for joining us this afternoon. We assume you would be that one or two things from today's discourse. So I'll be inviting my colleague Deborah. Deborah, let's have you.
Okay. Awesome. And awesome. It has been an awesome moment in the last 1 hour, 30 minutes. And I must say that my notes are really full. And on behalf of the board members of Images Initiative, we want to say a big thank you to everyone on this call who has joined us on this interaction. And we hope we had one or two learning to take away from this section, and also trying to also get that some of these things are implemented in our respective states. So thank you for joining us, and we wish to see more of you in our future events some other time. Thank you and bye-bye.